Good evening, and welcome to Doctors on Call. I'm Dr. Ryan Harden, faculty member at the University of Minnesota Medical School, Duluth campus, and I'm your host for our program tonight on Lyme disease, rashes, and acne. The success of this program is very dependent on our viewers. Please call or email your questions, and we will do our best to address them. The telephone numbers and email address can be found at the bottom of your screen. Our panelists this evening include Dr. Hilary Reich, a dermatologist with Gateway Family Health Clinic in Moose Lake, and Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates. Volunteers for the Great Gardening Show are answering our phones. And now, on to tonight's program. So, Dr. Sanford, given that Lyme's disease is so common in our state, how does one go about avoiding getting Lyme's disease?
Well, the trick is that if you have to be out in the woods with the dog, you're going to be exposed to the little tick, the ixoides tick. So you want to use a good, heavy DEET repellent. And then most importantly, when you get home, check your skin and get a buddy to check your backside in places that are hard to see. But yeah, that's all we can do. People, just have to be consciously looking for the ticks.
And Dr. Reich, can you talk a little bit about what the rash that is associated with Lyme disease looks like, and if there's any other rashes that can be mistaken for that?
Sure. So the rash that we associate with Lyme disease is called erythema chronica migrans, or ECM, and it's this very classic targetoid rash. Importantly, it's always got a red center, and sometimes that red center can be so inflamed that it's actually kind of purplish or bubbly. The white area is less consistent, but there's always a red center. That red center can look like a couple other things. It could look like a bacterial skin infection, something like impetigo or cellulitis. If it is a little scaly and a little older, sometimes when a red rash gets a little older, it sort of gets scaly as it's healing up. It could look a little bit like eczema. The other thing to know about it is that it doesn't always appear right after the tick bite. It can occur days to weeks after, and so you may not associate it temporally with your tick bite because it's separated in time by days to weeks.
Thank you. Dr. Sanford, there's multiple types of ticks in the state of Minnesota and Wisconsin. How does somebody go about identifying the tick that can cause Lyme disease?
Great question. Yeah, basically if you can see it, it ain't an ixoides tick. I love that Dr. Reich pointed out that if you're looking at a beautiful poppy seed muffin, the little spots, those are ixoides ticks. And you can see on your TV screen right now the itsy bitsy little 1 millimeter ixoides tick compared to the old-fashioned wood tick. So don't expect to see them.
And Dr. Sanford, I actually had Lyme's disease, and it didn't present as a rash. So can you talk about other ways that Lyme disease can present?
Oh, you bet. All of the tick-borne disorders, whether it's Ehrlichia, babesiosis, or there's so many, they'll all usually present with fevers, sometimes really wicked fevers, shaking chills, drenching sweats. With Lyme disease, you'll get a migrating arthritis. One day it'll be your wrist is just so painful. The next day, my wrist is fine, but boy, my knee hurts. So those are the things to watch for.
And on to a different topic, Dr. Reich. I see a lot of patients in my practice that come in because they have concerns about acne and they haven't tried anything over the counter or non-prescription. What are some treatments for acne people can try before they come to see their doctor for it?
Sure. So there are so many really good products that are available over the counter right now. In fact, one of our mainstays of acne treatment is has recently become an over-the-counter product. This is something called adapalene. The brand name is different, but the product is adapalene, and so this is a topical vitamin A type cream that is a good starting point. Another thing that people often need to try first is good old-fashioned benzoyl peroxide, and so this is the classic teenage acne wash. A lot of people shy away from it because they're worried that it can be too drying, but choosing a lower strength product and not using it every day can really make this tolerable and can make a big difference.
And Dr. Reich, thank you for that. Another thing that I think is really important that we talk about tonight is how does somebody know if they have a mole that should be evaluated or removed by a physician?
Sure. So we use something called the ABCs of melanoma, and they're not an absolute, but they can be a guideline. So A is for asymmetry, and so if you're looking at a lesion and it's very asymmetric, that can be concerning. B is for borders. Usually borders that are changing, growing, or feathering out are concerning. C is for color. A melanoma can be any color, but the colors that I worry about the most are black, gray, a black so black that it's blue. D is for diameter, so something greater than 6 millimeters, which is about the size of a pencil eraser. And then E for evolving. Now, a normal mole can be any of those things, but if you have a mole that is multiple, has multiple atypical characteristics, or that is rapidly changing, that's when it really needs to be evaluated.
Thank you. Back onto the topic of Lyme disease, Dr. Sanford. One of the things that Lyme disease can cause is arthritis or joint pain. Can you explain how that type of joint pain might differ from other types of joint pain like osteoarthritis or rheumatoid arthritis?
Yeah, typically with Lyme disease arthritis, it'll move around. It'll affect multiple different joints. With rheumatoid arthritis, it's usually these first joints in the fingers. With psoriatic arthritis, it can be any joint like the wrist and usually the end joint of the finger. I mean, there's so many different things. Osteoarthritis is usually in stress-bearing joints like the knees, base of the thumb, wrists. But Lyme disease, you can get it in any joint.
Thank you. And a follow-up question to that, Dr. Sanford. One of our callers from Superior, how long does it take to get results for a Lyme titer or test?
Yeah, typically for a type of test called a Western blot, it can be anywhere from 2 to 5 days depending on the reference lab. And I think both Essentia and St. Luke's have their own templated Western blots, but don't quote me on that. And I don't know about at your clinic in Moose Lake, but
I can't answer that.
Yeah, but it's a few days. There's not really a good rapid test that I would trust because the Western blot will not only tell you positive or negative, but how many what are called bands of immunoglobulins are affected.
Thank you. Dr. Reich, a caller from Bovey, is there any new treatment for rosacea?
Well, it would be interesting to know what the caller has tried so far. There's lots of potential treatments for rosacea. So one thing that a lot of people have not ever had is laser treatment. People shy away from laser treatment because it's not always covered by insurance, but often that can make a real difference in the background redness and overall inflammation in their skin. So that may be something that the caller hasn't tried yet.
Thank you. And another dermatology question from a caller in Sudan. What can be done for warts on the face and what causes them?
Sure. Warts are a virus. They are a type of HPV or human papillomavirus. They're very common. They are not a dangerous type of HPV virus overwhelmingly. Warts on the face often are something called flat warts. And I sometimes like to start with a topical medicine called tretinoin for the treatment of flat warts, and this is a vitamin A type medicine that helps to slough that top level of the wart off more quickly and kind of assist your immune system in treating them.
Thank you. And Dr. Sanford, I was thinking this question might come up. Will there ever be a vaccination for Lyme disease?
Great question. If you might remember about 10, 15 years ago as you were driving south toward Sandstone, there was a big billboard up there showing a fellow saying, I could get vaccinated for Lyme disease. And they did have a vaccine for a while. And you notice it kind of went away, because what happened was a lot of people had residual achiness in the joints, essentially symptoms of Lyme disease. So they took away its approval by the FDA to give to people, but you can still get it for your pets. So I wouldn't hold your breath about getting a Lyme disease vaccine.
Thank you. Another question about Lyme disease from one of our callers, Dr. Sanford. Can a person get Lyme disease more than one time?
Yeah, I believe so. It's a great question. I'd have to look it up, but my understanding is that there are variants on the Borrelia burgdorferi critter bacteria that causes this. And then there also, you could get a double header, which is when you also get Ehrlichia, and then sometimes a triple header where you get babesiosis too. And I remember one patient who had all three, a triple header at once, and man, were they sick.
Thank you. Another derm question, Dr. Reich. Is there any treatment for lichen sclerosis? Maybe explain what lichen sclerosis is and then discuss treatment.
Sure. So lichen sclerosis is an inflammatory condition in the skin in which there is some scar-like change to the very outer layer of the skin called the epidermis, as well as the underlayer called the dermis. The skin gets, under the microscope we can see that it's thinner, but it can get kind of a woody or firm feeling. And it can turn kind of a violet, white, scar-like color and appearance. While it can be found anywhere on the body, often it's found on the genital skin, and so it can be really quite uncomfortable for a lot of patients. Our mainstay of treatment is with topical steroids, and so super potent topical steroids can help to shut that process down, drive away the inflammation, and help to normalize the tissue. We can't always make it all the way normal. A new treatment for lichen sclerosis is using fractionated CO2 lasers to actually help to break down some of that scar tissue and encourage development of new healthy tissue in that area.
Thank you. Another question about dermatology from one of our callers, Dr. Reich. Is acne contagious?
So acne is not contagious. Acne is an inflammatory reaction in the hair follicle unit in the skin, and it really is because of largely because of hormones in a person. Things about acne that can be maybe not contagious, but maybe shared by a family group or even a peer group can be, a family could share a tendency towards acne because of the way their hormones develop as young people are going through moving into adulthood. And then while for a long time we were telling patients that food and chocolate had nothing to do with acne, in reality we are learning that eating pro-inflammatory foods with a high glycemic index can make a really big difference in making your acne a lot worse. So that's definitely a characteristic that could be shared by a family or a peer group.
Thank you. Dr. Sanford, a question from one of our callers about Lyme disease. Once you have Lyme disease and you're treated for it, does it totally go away, or can it linger and hide inside the body?
Well, it's a wonderful and important topic. It's been such a painful thing for so many people that they've had their primary Lyme infection, and then they'll have achiness, fatigue, feel slothful, and they get labeled as chronic Lyme. The problem is that the National Institute of Health, Center for Disease Control, doesn't recognize chronic Lyme as an entity. The IDSA, Infectious Disease Society of America, also doesn't. But there's definitely some type of inflammation that happens after Lyme disease where people just feel crappy. Sorry, I should watch my language. After they get Lyme disease. But when you look at their blood tests, when you do cultures, I've yet to ever see somebody who actually had the Borrelia, the bacteria in their system. And unfortunately, more often than not, people have some other underlying problem, whether it's polymyalgia rheumatica or like Linda Ronstadt, when she had multiple sclerosis that had been labeled as chronic Lyme disease. Anyway, there's a lot of people that are suffering, and it's just a matter of just being able to do careful diagnostic work.
And Dr. Sanford, a follow-up to that question, how is Lyme disease treated?
Well, good question. If you're a kid, I don't know, because my average patient is 100 years old. I treat gerontology, elderly adults. But for adults, anybody who's done growing and their teeth are all formed, doxycycline works beautifully. And usually it'll be a 3-week course of 100 milligrams twice a day. If people can't tolerate doxycycline, then some of the other medicines that are chemically related to the penicillins, like ceftriaxone, can be helpful. But it just really depends on the person, what their sensitivities are. But yeah, there are lots of ways to treat Lyme disease. We see a ton of it.
Thank you. Another question about moles, Dr. Reich.
Mm-hmm.
How can moles on the face be removed?
Moles on the face are challenging because the vast majority are benign. And so while I'm not worried about them, people may not like them and find them cosmetically unpleasant. There's a couple ways of taking them off. So the first thing I could do would be to just shave it flat using a scalpel. The downside of that is that a mole can be shaped under the microscope much like an iceberg, where there's a component that's above the skin and a component that's below. If I shave it flat, there's no guarantee that that portion that's below won't make pigment, or it could even grow back. To make it gone permanently and forever, I really have to cut the whole thing out and close it up with some sutures. And then you're trading a benign lesion that maybe is cosmetically bothersome only to the patient for a scar that is going to attract a stranger's eye more strongly. And so it's a fine line. I want my patients to be happy. I don't want them to have something on their face that they don't like, and that includes a scar.
Thank you. Somewhat of a follow-up question to that. A caller from Duluth wants to know, how effective are dermal fillers for wrinkles?
Dermal fillers can be terrific for wrinkles. However, they're not for every patient. So, if you imagine that there's a scale of wrinkles, some people have wrinkles only when they frown or only when they raise their eyebrows. Some people have some lines that are very faint and etched in. And then if you think about a very elderly person, they have wrinkles all the time, regardless of what they're doing with their face. So dermal fillers, I think, are best used in a patient who does not have those very deeply etched wrinkles, and where they're used thoughtfully to replace volume that's lost as part of normal human aging.
Thank you. I think this is another really important derm topic to discuss tonight. What are the 3 different types of skin cancer, and which one is the least invasive?
Sure. So there are 3 very common types of skin cancer. The most common, far and away, is something called basal cell carcinoma. Not only is this the most common skin cancer, it's the most common cancer humans get, period. The second type of skin cancer is something called squamous cell carcinoma. They are kind of related in that they have the same cell type. Squamous cell carcinoma is slightly less common than basal cell carcinoma, and it has a slightly higher chance of turning into something bad that's going to leave the skin and go into the body and make a person physically ill. Whereas basal cell carcinoma, it's not that it never happens, it's that it almost never happens. The incidence of a basal cell carcinoma going into the body and making a patient sick is on the order of 0.01% chance. And then there's the big baddie, melanoma, that everybody worries about. On average, we have a 1% chance of getting a melanoma over a lifetime. Melanoma, when caught early, is very treatable and curable. We rank melanoma's relative badness by how deeply it penetrates into the skin. And so that's why early detection is really important in getting it before it has a chance to go deep.
Thank you. Dr. Sanford, I think this is another important thing that we need to address tonight about Lyme disease. A caller from Duluth says his daughter was bit by a tick last fall and she had a red rash, but her test was negative. Can you talk about the or when you should do the test relative to when somebody has the rash with Lyme disease?
Boy, that's a good question. I off the top of my head, I don't know what they call sensitivity and specificity of a Western blot. I think that they're pretty good. So then you have to wonder, is it possible that it was a different type of rash? Did she have some type of an abrasion? Was it a type of bacterial infection of the skin called cellulitis? Yeah, it would really depend on the person. She would need to be examined and a few questions asked.
But if there was concern for Lyme disease, it would be reasonable to repeat the test.
Yeah, you certainly can.
Okay.
You certainly can. Especially if they're having fevers, chills, migraine, arthritis. Yeah, not all people with Lyme disease have a rash.
Thank you. A caller from Duluth has a question about how is the best way to manage seborrheic dermatitis?
Sure. So seborrheic dermatitis is a condition in which a person's immune system is upset and reacting to a normal yeast that's on every person's skin. We manage that in two ways. Firstly, we reduce the amount of yeast on the skin, and secondly, we reduce the amount of inflammation that the body is generating. And so starting with something like ketoconazole shampoo or cream is often a good go-to starting point, and then using something like an over-the-counter 1% hydrocortisone cream can be really helpful at low-tech, low-cost.
Thank you. Dr. Sanford, here's a great question about Lyme disease. Is it possible for the body to fight Lyme disease by itself without using antibiotics?
Yeah, it's been going on for probably millions of years. Lyme disease was identified out in Lyme, Massachusetts, or was it Connecticut? Connecticut. And that was when they put that name on it. But for millennia, thousands of years, people have probably been having their febrile illness with the achiness in joints that moves around, and somebody just finally put a name on it. But you have that interesting map showing the distribution of where you would see Lyme disease in this country, and if somebody can bring that map up on the screen, see there you can see out there in Connecticut, Massachusetts, and then you get into the Michigan, Wisconsin, and of course Minnesota. Now you ain't gonna see it pretty much anywhere else in the country. So if somebody tells you they got Lyme disease in Arizona or Hawaii, then they've been smoking something.
Thank you, Dr. Sanford. Dr. Reich, I know a lot of my patients are going to appreciate if you answer this question. Is there a cure for toenail fungus, and what's the best over-the-counter treatment?
There is no good over-the-counter treatment for toenail fungus. Sadly, there just isn't. So the best way to treat toenail fungus if you really need to kill it is with an oral antifungal. A lot of people have heard that the oral antifungal is going to take their liver out forever, and so that it's a dangerous thing to do. With appropriate lab monitoring, it can be very safe in the right patient, but it's the only way to get any sort of surety that you're really treating that toenail fungus. If they really want to do an over-the-counter thing, there are some studies with occluding the toenails with Vicks and soaking in vinegar nightly for a year, and that may give you a 15 to 20% chance of treating it, and I don't like those odds.
Thank you. Dr. Sanford, this is another question that comes up a lot in my practice. Is it possible to ward off Lyme disease after being bitten by a tick by taking an antibiotic immediately without having a blood test?
Yeah, it can be done. If people had truly a documented ixoides embedded for more than 48 hours, I've been guilty of giving people doxycycline, prophylactically, and yeah, it can be done that way. We try to avoid antibiotics as much as possible because antibiotics mess with the happy bacteria that are so important for digestion, our microbiome of the intestines. And antibiotics, kill a lot of people every year. People worry about 6 people dying of the COVID Johnson & Johnson vaccine, and bless their hearts, it's very sad that they died. But we're talking tens of thousands of Americans who perish from antibiotic-associated complications every year in America. So I'm not a big fan of using antibiotics prophylactically, but I know that we do it.
And as a somewhat of a follow-up to that question, and you had mentioned this earlier, Dr. Sanford, can you revisit the role that DEET plays in preventing Lyme disease?
Boy, good question. You know, I don't know its actual function. I don't know if Dr. Reich, if you know, or
I don't actually know the mechanism of action. I just know that it is it's toxic to the ticks, and so they do not attach.
Yeah, it's interesting. In the old days, people, this is going to sound awful, but people would take their earwax and rub it on their skin. There's something in the polymer of our earwax that is an incredible bug repellent.
But DEET is an effective way to prevent getting exposed to Lyme disease and getting tick bites.
And there's some anecdotal stuff about not wearing blue, because wearing blue apparently attracts ticks. I don't know if that's true or not.
Thank you, Dr. Sanford. So I want to thank our panelists, Dr. Hilary Reich and Dr. Paul Sanford, and our phone volunteers from the Great Gardening Show. Please join Dr. Ray Christensen next week for a program on cataracts and eye problems when his panelists will be Dr. Todd Britton and Dr. Kevin Tracy. Thank you for watching. Good night.